Thanks, Ed. Good morning, everyone. Bonjour à tous. I'm somewhat comforted this morning and not surprised to see that there will be much overlap between what I will speak about and what some of the speakers have highlighted this morning. Not unlike what John had mentioned earlier, when I meet with government officials across the country, there's a great consensus on the job to be done. For example, what I'm going to talk about this morning, community care, putting patient at the center of the circle of care. I haven't met a single official that goes, no, it's not a good idea. They're all violently agreeing that this is a good idea. They have one thing in common, though, they're missing the path to get there. And that's what I want to talk to you a little bit more about today. I've got a bit of a contrarian point of view on healthcare in general. You might have read about it, you might have heard it, but I happen to believe what the system needs is not necessarily more money, it needs more innovation. And the innovation that becomes essentially self-funding. And there's an appetite for innovation that lowers cost and improves outcomes. And the sweet spot is right there when you can achieve both. And there's a few ingredients that are required to make this work. One was mentioned this morning as well. We need a long-term vision from a decision-making standpoint, and take a system view of the overall system, and not so much be worried about every individual silo, because that progress will never happen without this. It takes a little bit of courage along the way. I'm going to make a decision that's outside of my election cycle horizon, may only pay out in 3-4 years, but it's the right thing to do for the system. But first and foremost, it requires collaboration. Collaboration not only between government and industry, but collaboration within the industry. I'll offer you a personal thought here. I think we're still, as a collective cross-sector industry, failing at representing a view of what the system-wide perspective may look like for the decision makers. And some of that responsibility is incumbent on us. So my talk today, I want to highlight a little bit of McKesson's role in making some of that happen from a community care standpoint and technology. Some of you might wonder, why would McKesson be talking about a topic like this? They're a distributor. We've evolved dramatically in the last 10 years, and this slide aims at illustrating this. And we've obviously diversified quite a bit in the last 10 years. If you look at the blue dots there, it's our distribution network, 14 DCs across the country. You're familiar, most of you, with this. We've got 8 specialty pharmacies geographically located as well across the country, over 100 infusion clinics when you put them together with specialty pharmacy that offer a variety of potential partnerships and services. We're just shy of 2,000 independent pharmacies that are affiliated to one of our 5 banner programs, and we're firm believers that the pharmacist, in terms of intervention at the point of care, is one of the most underutilized levers from a healthcare standpoint. I'm glad that governments across the country are starting to recognize that. We've got our own private label of generic medication, cross-licensing with other partners, but Civim has achieved a 0 out-of-stock performance in the last 3 years for pharmacies across the country, and that alone to us is a big idea in a world where supply chain becomes a hot topic on a regular basis. And at the very bottom, this is supported by our technology assets. We've got 5 different business units that are driving productivity through technology for all kind of healthcare stakeholders. I'll speak about this morning. So for us, it's not about a collection of assets, it's about how do we connect the dots, so to speak, for our own productivity, but for stakeholders' productivity across the system. And our ecosystem is made up of all the current stakeholders that you're aware of within healthcare. Our motto is to drive better health. It's for better health. And that, if what we do doesn't derive one of those 3 things, for better business for our partners and customers, for better care for patients, or better connectivity from a system standpoint, then we're not working on the right things. And in the end, we want to impact every single one of those stakeholders positively, because we're at the very center of things. We're invested with every single one of those stakeholders in one form or another, whether it be governments, private payers, manufacturers, pharmacies, hospital systems, name it. We are involved in a commercial relationship with most of those assets, and increasingly with patients as well, as I'll talk about in the next few minutes. Most of you might be familiar with that quote from André Picard, but essentially our healthcare system was built 50, 60 years ago to deal with very acute conditions. And by and large, for those of you that have experienced it, it's still very efficient to deal with. If I've got health issues in terms of or a stroke, for example, it'll take great care of me. The challenge becomes when I exit the system, when I'm back home, when I'm suffering from a chronic condition, I'm not really no one's taking charge of me. So we discussed the patient at the center earlier. It's a trend. The tools are not there to support making that part of the reality within the system. And that's where we and other players come in to affect change. We see 3 gaps to achieve community-based care in Canada. One is information sharing, dramatically underdeveloped, dramatically unstructured. A number of trials and errors have taken place. Most decision makers are shying away now from making investments in that field based on having invested already hundreds of millions of dollars with very little to show for. Patient monitoring is also a significant gap. The patient can research, can find material on internet. In terms of managing their own health, it's another gap. And then system capacity. I mean, lack of access remains a significant challenge. So creating capacity within the current system becomes a big idea. And I'll give you 3 examples of how together as an industry and us as a stakeholder within it, we're trying to affect change on A, care coordination, B, chronic care professionals, and 3, in terms of enhancing capacity. The first example has to do with Relay Health. Some of you might be familiar with this. This is our electronic health record platform. 5 years ago, selling an EHR platform to the public payer involved backing a 53-footer truck full of boxes and wires that you were trying to connect with their current systems, and guess what? Most experiences have only partially worked because system interoperability was not addressed. And this is a low infrastructure, web-based, low-cost platform that actually connects all the various systems together. It's been used with much success in Nova Scotia. 3 health links adopted it so far in Ontario. But I'll give you one stat that I find quite interesting. In Nova Scotia alone, physician capacity was increased by 22% through better interface between the patients and the doctors in terms of instant messaging through the Relay Health platform. That became a teletriage tool, essentially, where patients decided to either go to a pharmacy to get their minor ailment treated or stay home because they felt reassured through that communication with their doctor. 22% capacity increase in physicians in Nova Scotia is not a small idea. Multiply that across 13 provinces or territories, you've got a pretty big concept there. So we know this works. The question is, how fast can we implement change? Are we willing to make those kinds of investments? Are we willing to take the long-term view? Chronic care professional. This is an example where most of you might not be aware of this, but we've got a call center with over 60 nurses on staff and a variety of chronic disease management modules that are being leveraged, especially in Atlantic Canada, for all kinds of patient care continuum and treatment in terms of follow-ups on treatments. Type 2 diabetes patients in Nova Scotia, very successful intervention there. In Newfoundland as well. Increasingly, bringing care to the community doesn't mean building brick and mortar and infrastructure. It means investing in the right technology platform and leveraging other means. And you can have access to nurses for some conditions if we just set up the right system, leverage it. You don't have to build more facilities necessarily. And that unclogs the system as well. Talk about creating capacity. I mean, increasing adherence through programs like this, because that's one of the effects, keeps patients out of the ER. We all know this. Third example and last example I wanted to share with you was enhancing capacity. I'm missing a piece of the slide here, but we're firm believers, again, in the role of pharmacists in the healthcare continuum. We see that increasing in the future as well. We see an increased level of alignment between trade associations in terms of pharmacy, in terms of physicians as well, and government is playing a key role in driving this. Our own assets in terms of specialty pharmacy and fusion clinics has to do with providing care within the community setting. We're going to keep driving this in partnership with you guys as well. And we believe in the use of technology within the hospital networks as well. So we've got a suite of assets, and today is not the object of telling you about all of our assets, but two examples there. Our performance visibility tool and our capacity manager tool aim at driving efficient use of resources at the ward level for both staffing and for patients as well, bringing better visibility for the entire hospital in terms of where do I have capacity, where do I lack capacity, and how can I better manage it real time. So my last slide is, what does it mean for you? Why would I be standing here talking about this to this audience this morning? Well, ultimately, improving adherence, improving system capacity benefits you directly. Accessing better data through technology, call it the Relay Health platform or otherwise, becomes a big idea for you as well to manage your pre- and post-launch programs. So we believe that by partnering in terms of taking a system view of the healthcare, I'll call this the healthcare ecosystem for lack of better terms, we can affect change together. We also believe that none of us will be able to efficiently affect change in working on our own. And those examples were not happening in isolation. They were all the fruit of a partnership within the industry, and I'm looking for much more of those going forward for the benefit of public payers and bending that curve that everyone's trying to address. But trust me, that light at the end of the tunnel we spoke about earlier will remain very dim if we don't partner to address it. With that, thank you, and I'll invite John to the podium.